So good morning students. So today I'll be teaching you the duodenum, which is a part of the small intestine. So in this lecture we'll finish the duodenum, and in next lecture we'll finish the jejunum and the ileum part of small intestine. Okay, so let's start with the duodenum. So duodenum, as everybody knows, like duodenum is it is a Latin, basically it's a Greek word. Okay, it's a Greek word, means dacutulos, which means the 12 fingers. It has a length of 12 fingers. Okay, so length of duodenum is equal to width of 12 fingers. So this is a Greek term. Okay, so the next important thing is the duodenum is the shortest, widest and the most fixed part of the small intestine. Okay, so this is the shortest, widest and most fixed part of the small intestine, and it extends from the pylorus of the stomach to the duodenojejunal flexure. Okay, so it is this duodenum, it is curved around the head of the pancreas. You can see here, so this duodenum is curved around the head of the pancreas in the form of letter C. It's a C shaped. Okay, it has a C shaped curvature which is curved around the head of the pancreas, and this duodenum is situated, or it lies above the level of the umbilicus. So this duodenum is this is the level of umbilicus, so it is situated above the level of umbilicus. Okay, so next is like duodenum as it is C shaped, so it has 3 flexures. Okay, so at the junction of as you know, it has 4 parts: superior, then basically first part, second and third and fourth part. So at the junction of first and second part, you will see there is one flexure that is called the superior duodenal flexure, and then at the junction of second and third part, there is another duodenal flexure that is called the inferior duodenal flexure. And then the third flexure is duodenojejunal flexure, where the duodenum continues with the jejunum. Okay, so there are 3 flexures you will study in case of duodenum. The junction of first and second part of duodenum, that is the superior duodenal flexure. Junction of second and third part, that is the inferior duodenal flexure. And where the fourth part, basically the last part of duodenum, when it is continuing with the coils of jejunum, then that junction is called the duodenojejunal flexure. Okay, so there are the 3 flexures in case of duodenum. Next, come to the what is the location of duodenum. So this is very important. The duodenum is C shaped around the, or it is curved around the head of pancreas. This is 25 centimeter long. Okay, so this is 25 centimeter long, and it is situated above the level of umbilicus, opposite L1, L2 and L3. So this whole duodenum is located just opposite the L1, L2 and L3, above the level of umbilicus. Okay, so it has 4 parts. One is the superior part. This is superior part, which is around 5 centimeter long. Okay, and then come to the second part, or it is also called the descending part, which is 7.5 centimeter long. Then third part, or a horizontal part, that is the 10 centimeter long, and the fourth part, that is ascending part, that is 2.5 centimeter long. Okay, so first part is 5 centimeter, second part 7.5 centimeter, third part 10, and fourth part is 2.5 centimeter long. So the lengths of all the parts you have to remember. Okay, so the total length of duodenum is 25 centimeter. Then come to the peritoneal relations of duodenum, like as a whole. Now we are just talking about the duodenum as a whole. So duodenum is a retroperitoneal organ. So most of the duodenum is a retroperitoneal organ, or you can say it is fixed to the posterior abdominal wall, or it is not mobile. Okay, so except its 2 ends, like it's the first end for proximal end and the distal end. Okay, so these two ends, okay, these two ends, they are not fixed, they are suspended by the folds of peritoneum. So otherwise whole of the duodenum is retroperitoneal, or it is fixed to the posterior abdominal wall. It is immobile except its proximal part and the distal portion, which are suspended by the folds of peritoneum, and the whole of the duodenum is covered partially by the peritoneum on its anterior aspect. So this is the anterior aspect, so anteriorly it is covered by the peritoneum. Then come to the first part. Now like I just want to tell you, this duodenum is very important. It can come as a long question, okay, in theory. So the duodenum first part, so you should know what are the relations, peritoneal relations and the visceral relations. In abdomen, when you study each and every organ individually, then you have to remember the peritoneal relations and its visceral relations. So you have to know, okay, peritoneal and the visceral relations. Now this you can see the duodenum, the first part, which is 5 centimeter long. Now if we are talking about the first part, now look at the first part. It extends from the pylorus up to the superior duodenal flexure. Now what is the direction of this part of duodenum? It is directed upwards, backwards, and it is going towards the right side. Okay, its length is 5 centimeter long. Okay, now you can see कि what are its peritoneal relations. The first part of duodenum के peritoneal relations क्या है? So this is the proximal part of the first part of duodenum. So this proximal 2.5 centimeter, the whole first part is 5 centimeter. जो proximal 2.5 centimeter है, it is movable. Okay, as I told in the previous slide also. So this is attached to the lesser omentum above. यहाँ इसके upper border पे lesser omentum attached है, and along its lower border the greater omentum is attached, and the other distal 2.5 centimeter, the remaining portion is distal 2.5 centimeter of the first part of duodenum, that is fixed, or that is retroperitoneal, or you can say it is covered by peritoneum on its anterior aspect. When the thing becomes retroperitoneal, it means कि जो posterior portion है, that is fixed to the posterior abdominal wall, and anteriorly on its, like anteriorly it is covered by the peritoneum. Now see the visceral relations of the first part of duodenum. Okay, so anteriorly, if you can see the first part of duodenum, it is related to the quadrate lobe of the liver and the gallbladder. Okay, quadrate lobe of liver and gallbladder. Now if you see the posterior relations of first part, I have taken another slide. So you can see here कि posterior relations of the first part. Posteriorly क्या क्या है? Bile duct is running. Hepatic, this is gastroduodenal artery, which is a branch of hepatic artery, which is further a branch of celiac trunk. So gastroduodenal artery is related posteriorly, plus portal vein is related posteriorly. तो ये इसके posterior relations है. ओके, सो एंटीरियर रिलेशंस में ऊपर इसके क्या रिलेटेड है? क्वाड्रेट लोब ऑफ लिवर आ जाएगा और गॉल ब्लैडर आ जाएगा. पोस्टीरियरली आई टोल्ड यू, एंड सुपीरियरली रिलेशंस क्या होंगे इसके? यहाँ पे हियर यू कैन सी द एपिप्लॉइक फोरामन. सो एपिप्लॉइक फोरामन, एंड inferiorly this is the first part na, of duodenum. So inferiorly what is related? Head and neck of pancreas. So this is the pancreas na, which is situated in its concavity. So the head and neck of pancreas is related inferiorly to the first part of duodenum. Now moving ahead to the peculiarities of first part. So the first part of duodenum is very important. Why it is important? Because this is the first part of duodenum which is affected by the peptic ulcers. So why the peptic ulcers are more common in the duodenum, in the first part of duodenum? Because due to the direct exposure of the acidic contents or alcohols which are reaching it from the stomach, like from the stomach it is directly reaching to the first part of duodenum. So if anybody is alcoholic, so the from the stomach the liquid content is directly reaching up to the first part of duodenum. So the first part of the duodenum, it gets more, it gets exposed to the acidic contents or which are coming from the stomach. So that's why this is more prone to the peptic ulcers. And other important thing about the first part of duodenum is that, like when you take a radiogram, okay, under the radiograms you will see there is the formation of duodenal cap. One duodenal cap is seen. What is this duodenal cap? This is nothing else, basically like after giving a barium meal. So barium sulfate, when you give a dye to the patient, now you want to see the GI tract, then you have given barium sulfate to the patient. Now this first part of the duodenum is seen as a triangular shadow. It is seen as a triangular shadow, which is called the duodenal cap. Okay, which is called the duodenal cap. Okay, so this is only seen in the first part of the duodenum, and moreover this first part of duodenum is supplied by this is the additional supply by the end arteries. I'll tell you in the slides, in the later slides. So these are the important things about the first part of duodenum. Now come to the second part. So the second part of duodenum is to 7.5 centimeter long. Now it begins at the superior duodenal flexure. Okay, so the second part extends from the superior duodenal flexure. Now it runs, or it passes vertically downwards. Okay, so it extends till the lower border of the L3 vertebra. So it extends till the lower border of L3 vertebra, then it turns towards the right side, towards the left side, and it continues with the third part of the duodenum. Okay, so this is your second part of duodenum, 7.5 centimeter long. Now you can say the second part of duodenum is very important, because sometimes out of whole duodenum now you can get question on the second part of duodenum. So second part को अच्छे से करना है. So what are the peritoneal relations, what are the visceral relations of the second part of duodenum? They are very very important. Okay, so second part of duodenum के peritoneal relations, now you know कि second part of जो duodenum है, that is thoroughly retroperitoneal, that is fixed to the posterior abdominal wall. Only anterior surface of this is covered by the peritoneum, except the middle, except near the middle. Okay, otherwise the anterior surface of second part of duodenum is like covered by peritoneum, but except it's near the middle. That's why we call the anterior surface of peritoneum, anterior surface of duodenum is partly covered by peritoneum. Okay, because there are some areas which are not related to peritoneum anteriorly. Okay, so this second part of duodenum is anteriorly, it is covered by peritoneum except near the middle portion where it is related to the transverse colon. ये transverse colon है, ठीक है, plus it is related to the root of the transverse mesocolon. Okay, so these are the things: root of the transverse mesocolon plus coils of small intestine. These are related anteriorly to the second part of duodenum. Okay, so peritoneal relations में क्या आया? This is retroperitoneal. It is anteriorly covered by the peritoneum except near the middle area where it is related to transverse mesocolon, root of transverse mesocolon, and coils of small intestine. Now the posterior relations. The posterior relations of the second part of duodenum is, it is related to the posterior relations में क्या आ जाएगा? So it is related to the anterior surface of, see, this is the dotted line, this is the second part of duodenum. So this second part में posteriorly क्या पड़ा हुआ है? Anterior surface of right kidney, right renal vessels which are coming out from the abdominal aorta, right edge of the inferior vena cava, ठीक है, and the right psoas major muscle. यहाँ नीचे right psoas major muscle है. So these are the things which are related posteriorly to the second part of duodenum. Now you can see here also posterior relations: anterior surface of right kidney, right psoas major muscle, right edge of the inferior vena cava, and the renal vessels which are entering into in the right kidney, the right renal vessels which are coming out from the aorta. Okay, so they are related posteriorly to the second part of duodenum. Now you can say this second part of duodenum, इसके laterally क्या है? Laterally what is found? This right colic flexure, ये right colic hepatic flexure आ जाएगा ना. So this is related laterally. Medially क्या पड़ा है? Head of pancreas पड़ा है, ठीक है, the head of pancreas is present. और you can see the superior and inferior pancreatico-duodenal vessels हैं, they are anastomosing in the concavity of the duodenum. इस C-shaped concavity में superior pancreatico-duodenal artery, inferior pancreatico-duodenal artery का anastomosis हो रहा है. So they are also related medially to it. Medially ही bile duct opens in the second part of duodenum. So bile duct is also related medially to the second part of duodenum. Okay, so these are the relations of second part of duodenum. The other important thing about the second part of duodenum is when you see the interior portion of the second part of duodenum, you will see the circular folds. These circular folds are the plicae circularis. Okay. These are plicae circularis. These folds are folds of Kerckering also. So basically these folds are permanent folds. Permanent folds means they are not obliterated by distension. जब distension हो जाता है small intestine में तो they are not getting obliterated. They are permanent. They are circular. They are thick folds. Okay. Now you will see in the interior of the second part of duodenum एक देखोगे major duodenal papilla और एक देखोगे minor duodenal papilla. ये जैसे papilla है ना, एक elevation है. So this you will see in the interior of the second part of duodenum. अब major duodenal papilla में क्या होता है? This major duodenal papilla is seen along the posteromedial. So this is a major duodenal papilla and this is minor duodenal papilla. So जो major duodenal papilla है, it is present on the posteromedial aspect of the second part of duodenum, 8 to 10 centimeter distal to the pylorus, क्योंकि pylorus से extension start है ना duodenum का. So 8 to 10 centimeter distal to the pylorus you will see major duodenal papilla. So major duodenal papilla के summit के ऊपर, on the summit of major duodenal papilla you will see the opening of bile duct and pancreatic duct, which is called the ampulla of Vater. ठीक है, so that is seen on the major duodenal papilla, and the minor duodenal papilla is seen 6 to 8 centimeter distal to the pylorus. So it represents the opening of accessory pancreatic duct. Okay, so these basically circular folds are seen in the second part of duodenum. They are most prominent in the second part of duodenum and these are permanent folds. Okay, as you go down, so you will see a longitudinal folds like plica longitudinalis is also seen. Okay, as you go down in the duodenum. So these are circular folds which are seen in the second part of duodenum. So major duodenal papilla क्या है, minor duodenal papilla क्या है? It means minor ऊपर हुआ ना major के, because this is 8 to 10 centimeter distal, this is 6 to 8 centimeter distal to the pylorus. और यहाँ पे कौन कौन सी ducts की opening है, that is important. Now you can see here, so this is the major duodenal papilla. So basically where on the summit of major duodenal papilla you will see the opening of hepatopancreatic ampulla, you can also call opening of bile duct and the pancreatic duct. Bile duct is controlled by sphincter called sphincter choledochus. Pancreatic duct is controlled by sphincter pancreaticus, and both unite together and form the sphincter of ampullae, and they also called the hepatopancreatic ampulla, and they open on the major duodenal summit of the major duodenal papilla. So you should know this thing. Now come to the duodenum, third part of the duodenum. This is the third part of duodenum. The third part of duodenum length is around, this is the third part, which is the longest part, 10 centimeter long. Okay, it extends from the inferior duodenal flexure up to the inferior duodenal flexure से लेके, ठीक है, and it is it is running on the right side of the lower border of the third lumbar vertebra. So basically it begins at the inferior duodenal flexure on the right side of the this is the level of lower border of L3 vertebra na? Now it is passing horizontally towards the left side, ठीक है, and slightly upwards in front of the inferior vena cava and the abdominal aorta, ठीक है, and ends by joining the fourth part, ठीक है. So basically this third part of duodenum is around 10 centimeter long and it extends from the inferior duodenal flexure and it is passing horizontally and it is going slightly upwards, and in front of the inferior vena cava and in front of the abdominal aorta it basically merges, or it ends by joining with the fourth part of duodenum. Now you can see the peritoneal relations of third part. Again, this third part is totally retroperitoneal, which is fixed to the posterior abdominal wall. Only anteriorly it is covered by the peritoneum, except in the median plane where it is related to the superior mesenteric vessels and the root of mesentery. Very 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 important relation. Like the third part of the duodenum का वैसे तो ये retroperitoneal है, but except anteriorly it is covered by the peritoneum and the posteriorly it is fixed to the posterior abdominal wall. जब anteriorly it is related to the peritoneum except along the middle portion where it is related to the superior mesenteric vessels and the root of mesentery. ये इसके आगे से पास करते हैं. Okay, so they become the anterior relations. ठीक है, these become the anterior relations. Now you can see the posterior relations of the third part of duodenum. पीछे क्या है? Right psoas major पड़ा है. Right ureter which is coming out from the right kidney, inferior vena cava, right gonadal vessels, abdominal aorta is seen posteriorly. So these are the things which are seen posteriorly, and origin of the inferior mesenteric artery. So these are related in posteriorly to the third part of duodenum. Now you can see the third part of duodenum. इसके सुपीरियर रिलेशंस क्या है? सुपीरियरली व्हाट इज प्रेजेंट? अनसीनेट प्रोसेस ऑफ पैनक्रियाज, हेड ऑफ पैनक्रियाज, दे आर सीन सुपीरियरली. इन्फीरियरली क्या होगा? इस थर्ड पार्ट ऑफ duodenum के नीचे क्या पड़ा है? कॉइल्स ऑफ jejunum. This is the third part of duodenum na? So these are the coils of jejunum. They are related inferiorly, so they become the superior relations and the inferior relations. Okay, now come to the duodenum का fourth part. So fourth part is 2.5 centimeter long. It extends from front of aorta, basically inferior duodenal. This fourth part extends from the front of aorta. This is from the front of aorta where the third part ends. It extends from there and it ends till the duodenojejunal flexure. So this duodenojejunal flexure is situated just 1.25 centimeter below the transpyloric plane. देखो, see this is the transpyloric plane. Just 1.25 centimeter below this plane, this duodenojejunal flexure is situated at the level of L2 vertebra. L2 vertebra, क्योंकि ये लोअर बॉर्डर ऑफ L3 था. सो दिस होल duodenum is situated opposite the L1, L2 and L3. So this third part is lowest most na, so it lies at the lower border of, it is lying opposite the lower border of L3 vertebra. So ये जो duodenojejunal flexure है ये थोड़ा ऊपर है, so it is lying at the level of L2 vertebra on the left side. ठीक है, and 2.5 centimeters to the left of the median plane. So now this is the duodenojejunal flexure. Okay, where it is continuing with the coils of jejunum. Now we are talking about the fourth part of duodenum. Okay, so the fourth part of duodenum is, again it is covered by the peritoneum. It is इसके peritoneal relations क्या है? Now this is again the retroperitoneal structure. Okay, the fourth part of duodenum is retroperitoneal. Okay, covered by peritoneum only anteriorly, only except the terminal portion. बिल्कुल terminal portion जो है ना, that is suspended by the coils of, that is suspended by fold of peritoneum or mesentery. Okay, and that is mobile. So basically what I mean to say, this fourth part of duodenum is totally retroperitoneal means fixed to the posterior abdominal wall, and anteriorly it is covered by the peritoneum except its terminal portion which is mobile. Why mobile? Because it is suspended by folds of mesentery or fold of peritoneum. ठीक है, now you can see these are the peritoneal relations. Now come to the visceral relations of fourth part. Visceral relations में क्या आएगा? Anteriorly what is related? अब इसके anteriorly क्या है? Transverse colon पड़ा है. See, this is the transverse colon which is coming out, because here in this picture the transverse colon का middle portion has been cut. So you can see the anteriorly fourth part के relation में क्या है? Transverse colon है, transverse meso, root of transverse mesocolon है, and lesser sac and stomach, because stomach का कुछ portion भी it is like यहाँ पे, that is also covering this duodenojejunal flexure. Okay, so stomach is also coming in anterior relation of this fourth part of duodenum. Now come to the posterior relations. See the posterior relations में क्या क्या आ जाएगा duodenum के posterior relations में. You can see, because this duodenal fourth part of duodenum is seen on the left side na, so left things you will see. Left sympathetic chain is seen, left renal artery, okay, so the left gonadal artery and inferior mesenteric artery ka origin from the ventral aspect of the abdominal aorta. So these are the things which you can see which becomes the posterior relations. Left sympathetic chain, left renal artery, left gonadal artery and left suprarenal vein, ठीक है, left suprarenal vein and the left crus of diaphragm, ऊपर से left crus of diaphragm, ठीक है. So these are, and the origin of inferior mesenteric artery. So these become the posterior relations of the fourth part of duodenum, which is 2.5 centimeter long. This is the smallest portion na. So you can see the fourth part के relations के right side पे क्या है. What is seen on the right side? Uncinate process of pancreas. What is seen on the left side? The left kidney and the ureter, they become the relations on the left side. Superiorly what is seen? Body of pancreas पड़ा है, ठीक है. अब और उसके बाद अब what is now till now we have finished the relations of the duodenum. So these relations are very important because duodenum is one organ whose relations are commonly asked in the exams, ठीक है, out of whole duodenum. Otherwise to duodenum as such as a whole it can come into your exams as a theory question, long question, but second part के relations they are utmost important out of all. So basically duodenum is very important. You should remember each and everything about duodenum. Now come to the arterial supply of duodenum. So what is the arterial supply of duodenum? So most of the duodenum except the first part is supplied by the superior and inferior pancreaticoduodenal arteries. देखो superior pancreaticoduodenal artery and the inferior pancreaticoduodenal artery. So these both are anastomosing in the concavity of the duodenum, ठीक है, and they are supplying the whole of duodenum. Okay, so the superior pancreaticoduodenal artery okay, so the basically the anastomosis which is basically done by the superior and inferior pancreaticoduodenal arteries in the concavity of duodenum. So is anastomosis से small end arteries they are coming out. These straight vessels they are called the vasa recta. They supply the adjacent areas of the duodenum as well as the head of the pancreas. Okay, so the veins which are commonly corresponding to the arteries they drain into the superior mesenteric vein and the portal vein. Okay, so this is the arterial supply of the duodenum. Now only the exceptional part is the first part. The first part of duodenum is also supplied by it receives the additional supply. So basically the first part also receives additional supply from where? It is supplied by end arteries coming out from the supraduodenal artery. One artery is called the supraduodenal artery. Supraduodenal artery is a branch of gastroduodenal artery. Gastroduodenal artery is a branch of hepatic artery proper. Hepatic artery proper is a branch of common hepatic artery. It is a branch of celiac trunk. So I will take lecture on this. Okay, what are the branches coming out from the abdominal aorta, ventral aspect say like celiac trunk, superior mesenteric artery, inferior mesenteric artery. Further उनसे क्या branches आई. So I will take separate lecture on this. ठीक है, probably after the next lecture I will take lecture on that. So in that lecture I will tell you in a complete manner कि what are the branches coming out from the respective arteries. So in this lecture I can't tell you the whole thing, you just remember. So when I teach you that lecture na, you can correlate then. Okay, so this is the supraduodenal artery, or this is also called the artery of Wilkie. So this is a branch of gastroduodenal artery. Okay, so this supplies the first part, it gives a branch to the first part, and again the retroduodenal artery. So this retroduodenal artery, it is a branch of gastroduodenal artery. Okay, so this is also supplies the first posterior part of the first part of duodenum. Then there is another branch, infraduodenal artery. That infraduodenal artery branch, it's a branch of right gastroepiploic artery. So this is the right gastroepiploic artery. So this right gastroepiploic artery gives the infraduodenal branch. This also supplies its lower margin. So these are the some additional supply to the first part of duodenum, like the supraduodenal artery, ठीक है, which is also called the artery of Wilkie, branch of gastroduodenal artery. It supplies its upper margin. Okay, retroduodenal, it's a branch of, again a branch of gastroduodenal artery. Infraduodenal artery, it's a branch of right gastroepiploic artery. It supplies its lower margin. So basically only the first part of duodenum, it receives additional supply from these respective, from basically these arteries. Now what is the lymphatic drainage of duodenum? So these are few along the concavity of duodenum. Now you will see there are pancreatico-duodenal lymph nodes are present. So the lymph vessels drain into these pancreatico-duodenal nodes. From the pancreatico-duodenal nodes, few efferent vessels they start and they drain into the celiac lymph nodes. Okay, celiac lymph nodes. So these are hepatic lymph nodes which are situated just below the liver. These are pyloric lymph nodes which are situated along the pyloric area. So these are pancreatico-duodenal lymph nodes. So basically from the pancreatico-duodenal lymph nodes they drain into the celiac nodes, and from the celiac nodes they enter into via the cisterna galli or the intestinal lymph trunk. Okay, in this way the lymphatic drainage occurs. Now come to the nerve supply. So in each and every organ you have to remember its sympathetic nerve supply and parasympathetic. Parasympathetic nerve supply in GI tract, this is carried by the, and this is derived from the vagus nerves. Okay, and because they cause the secretions, vagus nerve parasympathetic supply, it causes secretions, and the sympathetic nerve supply, it is coming out from the T6 to T9 segments of spinal cord. Okay, so T6 to T9 spinal cord से preganglionic fibers आएंगे, and the preganglionic fibers further they form the celiac and superior mesenteric plexuses around the abdominal aorta, and from there basically the post ganglionic fibers they arises and they supply the respective organs. So T6 to T9 segment से sympathetic innervation आ जाएगा. Now what is the applied aspects of duodenum? So the first part of duodenum is very commonest site for the peptic ulcers. I told you why it is a commonest site for the peptic ulcers, because the direct exposure of the acidic contents which are coming out from the stomach. ठीक है, so generally जो first part of duodenum में जो duodenal ulcers होते हैं, they are mostly occur in the young persons, like who have a very busy personality, very tense personality, very anxious personality. So in those cases the duodenal ulcers they happen in the first part of duodenum. So generally what is the characteristic feature of the duodenal ulcers? They are basically they are relieved by the meals. They are relieved by meals. When you eat the food, they will the pain will go away, and they reappear on the empty stomach. Okay, so another thing, important thing about the first part of duodenum, like the duodenal cap, which you will see in the radiographs. Okay, so that triangular shadow will appear after having the barium meal. In the radiographs you will see the triangular cap, that triangular shadow, that is called the duodenal cap. Okay, so this is the applied aspect of duodenum. Other thing about the duodenum is sometimes there is a congenital stenosis. कंजेनिटल स्टेनोसिस हो सकता है duodenum में, और सेकेंड पार्ट ऑफ duodenum में जनरली कॉमन होता है, और द ऑब्स्ट्रक्शन ऑफ द सेकेंड पार्ट ऑफ duodenum हो सकता है. वाई इट हैपन्स in the second part of duodenum? क्यों? क्योंकि sometimes there is a congenital stenosis का cause क्या है? annular pancreas. Sometimes pancreas का formation complete नहीं होता. There is a failure of fusion of the two buds of the pancreas. So they surround the second part of duodenum like the annular pancreas. So it can cause obstruction to the second part of duodenum. Or sometimes there are other reasons, like the pressure by the superior mesenteric artery on the third part of duodenum. It can also cause compression. Okay, so these are the things which can cause the congenital stenosis or the obstruction of the second part of duodenum. Okay, so Now the last thing, which is very important thing, somebody can ask you about what is suspensory ligament of Treats. What is suspensory ligament of Treats? You can see this suspensory ligament of Treats. This is a fibromuscular band. Okay, this is nothing else. This is a fibromuscular band which basically suspends the duodenojejunal flexure. So this is the duodenojejunal flexure which is suspended by the fibromuscular band. Now this fibromuscular band, how it arises? So it arises from the right crus of the diaphragm. ये ऊपर जो openings दिख रही है ना, dome shaped, this is the diaphragm. So it arises from the right crus of the diaphragm to the right side of the esophagus. Esophagus के just right side से this band is arising and it is coming down behind the pancreas. ये pancreas के पीछे से आएगा क्योंकि इस concavity के अंदर pancreas is situated. So it is coming from behind the pancreas and it is attached to the upper margin or the posterior surface of this duodenojejunal flexure. ये duodenojejunal flexure के साथ अटैच हो गया and the third and fourth parts of duodenum के junction पे, और you can say the junction of third and fourth parts of duodenum. Now this this basically is suspensory ligament of Treats. इसके upper part में ना you will see there are striped muscle fibers और middle part में elastic muscle fibers होते हैं and the lower part में plain muscle fibers होते हैं. So this is the composition of this ligament of Treats. Now this ligament of Treats का इसका क्या function है? Normally when it contracts, जब ये contracts करेगा, it increases the, when it contracts this portion duodenojejunal flexure will go up. Okay, so this it increases the angle of duodenojejunal flexure. जो third and fourth part of duodenum का जो angle है, it will increase. Okay, and sometimes it is like sometimes क्या होता है कि its contraction may cause the partial obstruction of the gut. Sometimes its contraction causes the partial obstruction of the gut का obstruction भी तो हो सकता है ना, because this is lying at the junction of third and fourth part of duodenum. So जब इसका contraction होगा, this part will raise, it is pulled up. Okay, so it is causing little bit, it may cause partial obstruction of the gut. Okay, so this is about the duodenum. So duodenum itself is very important topic. So please hopefully you understand my lecture. If you have any queries, then you can ask me on the WhatsApp. Okay, so thank you so much. So next lecture I'll be taking on I'll take on the jejunum and ileum, and after that I'll take the large vessels of the gut like abdominal aorta की क्या क्या branches हैं. Okay, now thank you so much. Now please do study properly along with the lectures. You please study well. Okay, so thank you so much.